A lot has been researched, published, debated, and taught about male or female menopause. But as they say, what is good for the goose is good for the gander. As we tackle what male counterpart of this condition that happens to men in the twilight of their years, male menopause. Good morning and a very warm welcome to Bonitas House Call here on SABC2. Mzigabao, Bantu bakaPhalo, noMzantsi Afrika uphela. Siyanibulisa kwindawo nendawo kumakhaya namakhaya apha niphulaphule nikhona. I'm Dr. Victor Aramathesele. Lena nongilukisisa ngaka kaTlu. Letlangwana Saturday sesen hora haile ya borobong Hussein. Now, testosterone is a hormone that is produced in greater quantities in men than in women. And it is essentially responsible for those qualities and characteristics that makes a man a man. Now, however, as its levels begin to decline with advancing age, men begin to experience changes that often have some detrimental effects to their lives and to their health. And today we want to focus on how, why, and wherefore with this phenomenon called male menopause. But first, let us watch this insert. That's going to tell us a little bit more about what Dr. Craige Golding had to say about male menopause. Let's watch.
Good morning to all of you folks at home. Most of us have heard about menopause. Whether it has been through a friend or an aunt, we all know about the irregular sleeping patterns, the hot flushes, etc., etc. We also know that some women hardly experience any symptoms at all, whereas others need to sit next to an open window during winter or have to carry fans in their handbag. But whichever way you look at it, menopause is a very uncomfortable experience for a woman going through the change of life. But that is not where the story ends. In today's episode of House Call, we are going to investigate male menopause. Does it exist, or is it a figment of our imagination? We are going to be talking to Dr. Craige Golding, who is a specialist physician as well as the Chief Medical Director at the Integrative Medical Center, and he is going to help us to find out more about male menopause. What is male menopause and what causes it?
Basically, it's the male equivalent of the better-known menopause, that ladies experience. Ladies often have quite significant symptoms, including severe flushing and weight gain that rushes them to the doctor, really. So andropause is basically the male equivalent of that. It's a much slower process, and the symptoms are more subtle and less severe. So often it goes missed and results in medical complications that we can go into.
What are the common symptoms and how can they be diagnosed?
The main symptoms really involve aging. So usually, weight gain, energy levels start to drop, muscle mass starts to decrease, erectile function starts to be affected, and then other symptoms that are more subtle, mood fluctuations, irritability, a little bit of anger, a little bit of anxiety, depression, energy loss, that loss of zest for life.
Is this a problem that affects every man?
It does affect every man at some point. The age, is usually older than in ladies. Obviously, we listen to the symptoms of the client or the patient, and then we do blood testing to check testosterone levels, estrogen levels. Often, as men age, they aromatase or they convert more testosterone to estrogen, and their sex hormone binding globulin, a protein in the blood, also elevates as a result. And then testosterone is bound to this protein in the blood, and free testosterone is decreased. So we check testosterone levels, free testosterone, estrogen levels, even adrenal gland function we check as well, because cortisol can rise with age too and can affect your testosterone production. So the main cause really is usually testicular failure, where you stop producing as much testosterone as a young virile man does. And sometimes there could be a pituitary issue, where your luteinizing hormone is decreased, which controls the testicular function.
Hey, we invite you to join our discussion by calling us on 083-913-4687, or you can send your SMSs to Bonitas 33723. As we welcome into the studio Professor Shingai Mutambirwa, who's a neurologist in many places, and he'll tell us a little bit more about that. Professor, thank you very much for joining us this morning.
Morning, Vicky. How are you?
Good, thank you.
Excellent.
The last time you were here, you were Dr. Mutambirwa. Now you're a professor. Congratulations.
Thank you very much.
When did this happen?
Last year, September.
Is it because you published papers and you've done all the good things?
Publish or perish, that's what they say. Yeah? So we're trying to do the best we can. Yeah.
Excellent.
That's right.
Yeah, and you still do some work in the private sector?
I do a little bit of work in private.
Where exactly?
In Soweto.
Oh, okay.
September Hospital.
Now we're happy that you can still contribute.
No,
and you put in South Africa on the map. I mean, that's very, very good. I mean, because I know you travel the world as well around this issue.
That's right. Well, I'm giving a couple of lectures here and there about various problems, including prostate cancer as well. Yeah.
I know you do a lot of work around prostate. We'll talk about that.
No problem.
Male menopause.
Male menopause, a big topic nowadays. It's actually getting more news and coverage as well, because we've recognized that the male chemical testosterone, which is produced by the testicles mainly, although it is produced a little bit by the adrenal as well, as Dr. Golding was saying, does start to decrease, and we think that it can be starting to decrease even from the age of 30, and maybe even less than that.
That's scary.
It is a bit scary, not to be too scared, but the point is that the testosterone is not only for sexual function. It's not just about the penis and the testicles and various other things, but it's also very important not only for your heart, for your muscles, for the amount of body fat, for bones as well, the amount of blood in your body as well, and also the sexual function as well. The mentation as well, the loss of problems with sleeping and various other problems like that are also related to testosterone. And in fact, the data shows that if a man over the age of 40 develops the first episode of depression, 50% of them, it's because of low testosterone.
Hang on. Yeah. Before you say all the scary things, let us take this testosterone for a while.
That's right.
It gets produced while the fetus is still sitting there in the mother's.
Very true.
And it's responsible for the early development of the male organs and everything else.
That's right.
Now, considering that both male and female fetuses, what is this function in the female fetus? I mean,
in the female fetus, it's also necessary for a lot of functions, including the production of blood and for energy, muscle, and various things like that as well. But it's also important for their sexual development as well. In fact, for females, the estrogens, the chemical produced by the ovary, is not actually what makes a female feel sexually active. It's actually their testosterone produced by the adrenal.
Don't say that. Seriously?
That's right. And that's why females also do have a decrease in their testosterone as they get older. And we're now looking at data which is actually showing that when females start to have problems in the older ages as well, it's not just based on their estrogenic levels going down. Their testosterones also may need to be supplemented as well. And we now are supplementing females as well when they have sexual problems and when they're increasing body mass around the middle, loss of body muscle, and increasing body fat.
Now, before we get into the details, now, if you look at testosterone as a hormone,
yeah,
you guys will teach us that it has got two major functions. It is androgenic, as well as all the other metabolic functions.
That's right.
Now, let's start with the metabolic functions. What does it do exactly?
The metabolic functions, to put it simply, the big reason why a lot of these issues about male menopause has come up, because we've recognized that men do die younger than women, and one of the reasons is because we die from cardiovascular events. These are strokes, loss of limb, heart attacks. And we've now recognized, to put it simply, that when your testosterone levels are normal, the stromal precursor cells, which are the cells which can become anything in your body, will go to muscle. But if you have a low testosterone, they go towards fat. And that's why a lot of guys out there, they'll say, no, I'm exercising, I'm controlling my diet, but I'm still gaining this beer bop in the middle. And the problem is that fat is, we now recognize that central obesity, it's actually an organ. It actually produces chemicals which go into the blood vessels, damage your blood vessels, cause you to get cardiovascular events. And that's why testosterone supplementation, if you do have a low testosterone, is so important to prevent not only the sexual problems, but also to decrease your risk of cardiovascular events. In fact, one of the things which we recognize when you have people with prostate cancer, one of the things we do is we get rid of testosterone, as you know, because prostate cancer is dependent on testosterone. And we now recognize that...
I don't want you to discuss that in passing.
Oh, okay.
because you say, as I know, but I'm not here for myself. I'm here because I've got many other people who are watching this show.
Okay.
Now, everybody understands that testosterone is responsible for development of your sexual organs.
That's right.
At puberty, it is responsible for the development of the secondary sexual characteristics, the breaking of the voice, the enlargement of the organs,
That's right.
and sexual function in a general sense.
That's
libido
right.
and all of those things are dependent on this hormone called testosterone.
Yeah.
But on the other hand, you are highlighting with us that you've got a whole lot of metabolic or anabolic functions of this hormone called testosterone, where it is responsible for development and functioning of the bone, of the muscle, of the other tissues. Now you're saying it also has a responsibility around how blood works, the development of the blood, metabolism of sugar and all of those things, cholesterol. And that is the part of testosterone that is often ignored.
Exactly.
And the problem is that as soon as your levels of testosterone begin to decline, you begin to have a whole lot of these metabolic functions that begin to set in. And the first of which, or the most recognizable of which, is a beer belly.
Is a beer belly,
or
exactly. Mkaba. And the whole point is that mkaba, we now consider it as part of what we call the metabolic syndrome, where the waist circumference, if you're above about 96 centimeters, which is not too much, and you have either diabetes, a high cholesterol, or if you have a low, what we call HDL, which is the good cholesterol, or you've got hypertension, you have a 50% chance of a cardiovascular event in the next 5 years if you've got any of those, of the beer bop with any two of the other problems that you got. And the thing is that we now know that sugar diabetes, high cholesterol, all of these things are actually cardiovascular events. They're damaging to the blood vessels. And that's why testosterone is so important, because if you have a low testosterone, your blood vessels, which are essentially muscles which are coated by a skin covering, the muscles start to be converted towards fat, and therefore you get damage to the skin covering of this inside of your blood vessels, which then lead to clots, which will then lead to damage to your blood vessels, which cause you to get cardiovascular events. So all of these things are dependent very significantly on testosterone, and that's why we're focusing so much on it nowadays.
And in essence, as you grow, and you say from the age of 30 now,
probably, we don't know, even lower, some people are saying.
Professor Shingai. Okay. Okay. So it begins to decline gradually, though.
It does decline.
And as it does so, all of these other effects, begin to set in. Visceral fat, metabolism of sugar, metabolism of cholesterol, metabolism of hypertension, and all of these things. So as it declines, your life becomes more and more at risk.
That's right.
Why does it decline?
We're not quite sure why it's happening. We suspect it's probably similar to the female menopause, that just as the years go by, the testicle starts to not work as well. But the point is that we don't know exactly what the reasoning is. The point is that at the end of the day, it's not really that important what's causing it. I think the more important is that we recognize that there is a problem there, because the treatment for it is relatively easy nowadays. And in fact, when you do, the data which is coming out, especially if you from England, let's put it this way, that if you're a diabetic, and you have a low testosterone, we now recognize that if you supplement your testosterone, you can actually get rid of one of the drugs that you're on for treatment. Because
sounds interesting.
Let's
hold it there. There are many issues, and how do you recognize it? If I'm so to a ana disease hare lebelo le afela tota esala kapa hare diabela diahlweba madiba hopsa amadala. We'll continue our discussion on menopause. Hang re khutla papatsong hara matheola. Mokgakgaetso le bona sepedi se re khudu e gwalela gapa la yona tabe ngwe ya banna ba ono fellwa ke matla mola ba ntse ba gola rena ha re tla tša ra se khupa maramane rena re tla bolela ka ona le se ka le gono re gopela gore tshwara ka motato mo nomorong ya 0839134687 go ba mafatlata SMS mo Bonitas 33723. But before we continue with our discussion on this rather interesting subject, let us watch another report made on male menopause. Let's watch.
What are the possible treatment options and the challenges that you face sometimes during treatment?
It's important to check estrogen levels, as well as other hormones that occur in the body, like insulin, for example. It's important to check cholesterol level, because cholesterol goes up as testosterone goes down, because cholesterol is used to make testosterone and your steroid hormones. The most common ways of replenishing testosterone would be either intramuscular injections. We use a lot of bioidentical testosterone made at our compounding pharmacy at the Integrated Medical Center. This is a transdermal gel that you apply daily at the percentage dose of the testosterone that you as an individual require.
We have been trying to secure an interview with somebody to talk to us about their male menopause, but they're very reluctant. Why do you think we've been so unsuccessful?
I think there's a few reasons for that. Doctors or men generally don't like to go to the doctor in general. Women are generally better patients in my experience. However, erectile dysfunction, does encourage a man to visit the doctor. But it is a very personal issue, if you have erectile dysfunction or weight issues or depression. And I think that's best discussed, with your doctor. And I think most men, perhaps their ego is a bit dented or they're a bit embarrassed.
When was it first described? Because not a lot of people seem to know about it.
Look, the first study that I can recall was in the 1940s in the Journal of American Association. It's just, as I mentioned earlier, the symptoms are more subtle than with the female equivalent menopause. So often it goes by without being diagnosed.
What do you think some of the psychological effects could be on a man who is going through male menopause, on him and on his family?
The mood itself is affected significantly by andropause. And then the man's pride and ego is affected by erectile dysfunction. And that can obviously affect the relationship that he's involved in. And it can also affect his emotional well-being in terms of his own self-respect. And that often has, it can have devastating consequences on a family dynamics.
Is there any final advice that you would like to give to viewers out there who think they may be having symptoms?
Don't delay checking if you have any of these symptoms. It could be an early warning sign of something very serious that may be underlying medically.
Well, thank you very much, Dr. Golding. I appreciate your time. To all the gentlemen out there who think that they could be suffering from this condition, it is very important that you pay a visit to your doctor because help could really be on the way. Well, thank you so much for joining me on my visit, and I hope you enjoy your day. Back to studio.
Professor Shingai, this is scary stuff, but let us accept that it is something that happens.
That's right.
But it is quite apparent that a lot more would be derived by way of benefit if more men could know that they are beginning to have male menopause or decline in testosterone, as it were. Some people call it andropause. Yeah. And maybe I get a sense that not as many people who should be getting treatment are actually getting treatment. Okay. But the point is, how do you diagnose it and how do you begin to suspect? Because as opposed to the female menopause, it doesn't look like it's got specific symptoms like hot flushes and that kind of thing. How do you recognize it? How do you diagnose it?
Well, it does also have the similar things with hot flushes as well when it gets to that stage, because you also get the same problems. You get loss in as Dr. Golding was saying, there are a lot of subtle things that you can pick up. The most obvious probably is that beer bob, the beer belly, because the point is that we know that fat is going to be deposited there even if they're exercising, if they do have a low testosterone. So that's one of the first symptoms. The other things are more subtle, but the sexual functions are probably the first ones to go. So if you start having erectile dysfunction, you should be getting your testosterone checked. If you're having decreased libido, the feeling of having sex, you should be getting your testosterone checked. But then there are other things, such as, for example, the fact that you're going to get hypertension, the fact that you're going to get diabetes, the fact that you're going to be having problems with mentation, you're not going to be thinking so well, you're having problems sleeping, you're not thinking as well, you're not forgetting, being more forgetful, and you're also becoming more aggressive and irritable as well, even though low testosterone does cause you to become more irritable and aggressive because you're having the loss of feelings of power and energy as well. So the point is that I usually advise my patients that you should be getting checked probably at least from the age of 30, once a year. Just go to your physician, get yourself checked for your blood pressure, get yourself checked for your cholesterol, get your testosterone checked, and once you reach about 40, if you haven't got any family history, get your prostate checked as well. Literally, that takes about 5 minutes to do, and after that, you're going to be saving yourself a lot of hardship and problems, because the treatment for the testosterone particularly has so many benefits. I mean, one of the studies which was done in Sheffield in England, the people who had low testosterone, it's one of the studies which have shown that people as you know, most people don't usually follow up well when they're on treatment. But the people who had low testosterone, when they're being supplemented, they had a 95% follow-up over a year. So basically, they were coming back for their treatment because it was so important for their general health as well.
And they can see the benefits.
They can see the benefits.
We'll come back to that. Ntite, you're joining us from Mahikeng. Thank you for joining Bonitas House Call. Good morning to you.
Good morning, doctor.
Yes, Ntite.
Yeah, I'm phoning from Abato.
Oh, yes, sir.
In Mahikeng.
Okay, there's a difference. Anyway, Ntite.
I'm getting excited about your topic. Because I'm 52 years old.
50?
52.
Oh, 52.
Yeah. I'm losing my libido. My sexual problems are great. And then I'm frustrated. I don't know what to do. The only thing that I have is a high blood pressure. I don't have sugar diabetes. I don't have any other diseases.
What treatment are you on for high blood pressure? Some of the medications used for high blood pressure can have that effect, actually. What treatment are you on?
I don't have my treatment with me.
Sorry?
I don't have with me at the moment, but this Cipla, what 30 and the treatment that I'm getting.
Okay.
Yes.
You want to ask any questions, Prof?
No, I think he's pretty much, basically displaying most of the symptoms of testosterone deficiency syndrome, and including the hypertension, because do remember, hypertension is a cardiovascular event, and low testosterone predisposes people to develop hypertension, and also when you're on treatment, hypertension can be treated with the testosterone. And remember that although we're talking a lot about the testosterone hormone itself, there are some natural ways of actually enhancing it.
But hang on, let's start. Do you say to Ntite, one of the first things he must do on Monday when he gets back to circulation is to go to a doctor, and he must do his testosterone levels.
He must get his testosterone levels.
And if the levels are low enough, he must begin to consider supplementation or treatment.
That's right. Okay. That's right. Because really the only side effect.
Ntite, did you hear that?
Yeah, what kind of supplementation?
Well, the point
you keep on listening, because he's going to answer your question, and we hope that everybody else who's in a similar situation will benefit from that as well. Right. So you are saying he's likely to be having testosterone deficiency based on his symptoms, based on his age.
That's right.
And then the issue is that he must be encouraged to go check the levels of that. And he must check his prostate as well. Correct. Not because prostate cancer is caused by testosterone, but because if you do have active prostate cancer, you do have to assess what's happening with the testosterone, because if that is, you can't really supplement when the patient has active prostate cancer. What is the relationship between testosterone and prostate cancer before we go to
It's actually very complex. It's actually very complex.
Let's simplify it.
Okay, let's simplify it. If you have you need testosterone to develop your prostate, so you need testosterone to develop prostate cancer.
So one of the bad things about testosterone is that...
No, that's why it's so complex. That's why it's so complex.
Okay.
There's actually data to show that if you have a low testosterone, you're more likely to develop prostate cancer.
Correct.
Because that's actually what we call a saturation limit. You have to have a minimal amount of testosterone to develop your cancer, but the point is that if you if you have a relatively low prostate testosterone, you're actually more likely to get an aggressive cancer, and you're also more likely to develop prostate cancer. So it's not that supplementation is going to cause you to get prostate cancer. It's just that if you do have active prostate cancer, you do need to be a little bit careful about how you're going to be supplemented for testosterone.
Because more testosterone at that point might lead to more complications related to the prostate cancer.
Well, again, it's...
That's why you guys castrate. That's why you guys castrate people who've got prostate cancer, because the testes are producing too much testosterone.
We do, but remember that at least probably about 30% of the prostate cancers which people develop are not going to be giving any problems in the future. And in fact, there's some data to show that if you do have a prostate cancer and you're relatively old and you have low testosterone, supplementing the testosterone, it doesn't have any effect on the testosterone.
So how does Ntite raise his testosterone levels?
The most important thing, my policy is always less is more. Less calories in your diet, because that increases the amount of beer belly and decreases your testosterone by a very complex way. And also less laziness. Exercise is by far the best pill you can take. It increases your
exercise increase your testosterone?
It increases your testosterone. It decreases the amount of body fat. And in fact, the data which is out there shows that it's the only drug you can take that can decrease cancer rates. If you exercise 20 minutes per day, starting from youth, please, if you can decrease your cancer rates across the board, not just prostate, but all cancers by 30%. It's the only thing that can work. And it's also for females as well. Exercise is by far the best pill you can take. But even if you are exercising, you can still develop this testosterone deficiency. And if that does happen, then the supplementation will also increase.
Let's hold it there. Now, when you come back from the break, we are going to discuss exactly how testosterone can be supplemented and what are some of the other things that you might use by way of vitamins and those fancy things to ensure that your testosterone levels are up to the mark. We'll continue our discussion after the break. Welcome back. You're watching Bonitas House Call here on SABC2, and today we are discussing male menopause. Just before we take David. Now, if you've got somebody you suspect, you do blood tests, and the blood test will indicate fairly unequivocally that you got testosterone deficiency.
That's right.
What governs whether we are going to give somebody Nebido or Levitra or any of those fancy stuff?
Well, Levitra is actually not directly involved. None of the PDE5s, the ones that we use for erections directly, actually raise your testosterone. Testosterone has to be raised by parenteral, which means through the muscle or skin, blood supplementation of testosterone. And the point is that if you have a normal prostate, no prostate cancer, you've got a low testosterone, and the levels are we got some pretty good levels now. We now know that if your testosterone is below 12 nanograms per deciliter, and you've got symptoms, or if it's below 8, and even if you haven't got symptoms, you should be supplemented. Okay. The only side effects of testosterone supplementation are that you're going to suppress your sperm count temporarily. And that's the only other thing. Otherwise, you're only going to get benefits from it. There's a decrease in your chances of cancers, there's a decrease in your cardiovascular risk, there's a decrease in your blood pressure. All of these things are going to be benefits from testosterone supplementation. And unfortunately, there is an oral tablet that you can take called androxone, which is absorbed by the lymphatics. But the problem is that it also you have to take it 3 times a day, and it's a little bit expensive as well. But the point is that generally we're going to be doing it parenterally, which means that you're going to be getting an injection, which means that in our setting at the moment is that we only have Nebido as the supplementation, because that one doesn't give what we call the mountains and the valleys. You don't get the aggression and the depression from the short-acting injectables. Nebido actually gives you a nice steady state, which maintains your testosterone and is the only one which has been shown over the last 13 years to actually have these cardiovascular benefits as well.
So you do have a lot of patients who come to you for injections. How often do you inject them?
It's basically a 3-monthly injection. It is a bit pricey, and I plead to the medical aid schemes out there that please can we try to get it on as part of a benefit as well, because it provides medicine.
Because of all the advantages. I mean,
there's so many advantages.
Understand why medical aids wouldn't want to pay for this.
It's expensive, and they think it's just about sex, but in reality, it's actually about preventing cardiovascular risk as well. In fact, if you look at the data, you're going to be finding that patients who have low testosterone are at much higher risk. Up to 80% of them are going to be having cardiovascular problems in the future. You're going to be paying for high blood pressure medications, sugar diabetes, cholesterol medications in the future. But again, to go back, we must still maintain lifestyle as well. Exercise,
good food,
good calories, and no smoking, please. This is all bad.
Any supplements that might assist in raising up the testosterone?
There's nothing that's proven. None of these over-the-counter medications that you can get to actually increase your testosterone. There are vitamin supplements, this, that, and the other, which some people try to promote as increasing testosterone. No data. And in fact, if you're actually going to be taking anything which contains real testosterone, it's actually going to be damaging if you take it orally, because it actually causes what we call a first-pass effect to the liver, which actually damages parts of the liver, increases your chances of getting blood clots, increases body fluids and things like that. So there's nothing you can take over the counter. You need to go to see your physician, let him check it out, and then either take an injectable or gels, which are coming out in the future as well. They're the ones which are produced locally, but the ones that are actually proven overseas will only be out maybe, I think, in the next 2 or 3 months. But again, the gels, you do have to apply them once or twice a day. The injection is basically every 3 months.
That one,
that
people apply on their members.
So that brush, that what it's doing, that is not for testosterone. What it does is it contains actually a local anesthetic, which decreases the sensation to the penis, so that it does help with premature ejaculation in some people, but it's not directly involved for sexuality.
David, you are joining us from Pretoria. Thank you for joining Bonitas House Call. Good morning to you.
Good day, Doctor.
Yes, David.
It's a bit difficult to hear from your side. The line is disappointing me a bit. But I'll just pose my question.
You say you cannot hear us clearly?
Yes.
Oh, that's a pity. Okay. But we can hear you, David.
But let me just continue with my question. My problem is with I'm presenting similar symptoms that the doctor is talking about. But the problem is with the TSH. What the doctor tested on me was my TSH levels. Now I understand with the thyroid gland, there's 2 hormones. So the doctor did check the 2 hormones, and she actually prescribed the one. She said my other TSH, I think the TSH, there's 2. The other one was a bit low, but I took the TSH hormone. But I did ask another doctor now, going for another opinion about the testosterone test, and then he didn't seem to be very much interested in that. But I've been doing a lot of reading myself, and I was convinced that TSH could be an issue. But I just want to understand the relationship between TSH and the testosterone. itself.
Prof,
Okay,
thyroid stimulating hormone,
thyroid
TSH,
stimulating hormone. The thyroid is a gland which sits just around the neck here, and it does produce a chemical which is necessary for us to maintain our metabolism and our energy levels. And it can go down not only just by aging, but also by medications and things like that. TSH is extremely important, is basically a test to prove if there's a possibility of a low thyroid hormone. And if you do have low thyroid thyroxine in your body, you do need to get that supplemented. But there's no direct correlation between thyroxine and testosterone. They both work in different ways. They do work, they complement each other. But thyroid the low thyroid hormone is not as common as low testosterone. But if you do have both of them, then you do need to get both of them supplemented at the same time. But the point is that most of the time when you come in with low libido and aggression and things like that, we do check your testosterone as well as your TSH to prove that there's no low thyroid hormone. But in general, we found that most patients, it's mainly the testosterone more than the thyroid that's the problem.
So what advice would we give him then?
I think he needs to have both checked. If his testosterone is low and his thyroid is low, then he needs to get thyroxine, which is a tablet which usually has to be taken once a day, and also supplementation with testosterone, usually Nebido again.
Good. Now, in essence, you are saying any man from the age of 30, even if they may not have some of the symptoms that you're describing, must make it a habit to check their testosterone levels.
I would even say even from a younger age. The thing is that it's very interesting when you look at the global data that men and women, their health are similar until they reach around adolescence. And then what happens is the men start to deviate to negative, and females still maintain their health. And we think it's mainly because the mothers are taking their child to the doctor until adolescence, and after adolescence they make their own decisions. And we as men don't take our health seriously. We see our physicians 5 times less than females, and that's why we die younger than females as well. So basically once a year, or if you find any symptoms, go and see your physician. Just a quick checkup, make sure your blood pressure is normal, because even type 1 diabetes, it starts in younger ages. You can get low testosterone because of that at that age as well. You have to get yourself checked out, and at any age, if you have any sort of physical symptoms, any problems, you need to get yourself checked out. So once a year, go and get yourself seen. You can get these blood tests taken. If there is low, even from a younger age, there are methods besides just these injections, which we use in some patients. We use it off-label. We use some medications like the female ovary stimulator, clomiphene, can be used to stimulate testosterone in younger males.
But that's off-label. That's not
off-label.
what it's off-label. But it does.
But
it
does
can
work.
use it safely.
For also if you have a fertility wish. But if you don't have a fertility wish, you're not wanting to have a baby at the time, then the supplementation with the parenterals, usually the injectable, is necessary.
You did say, before we take Lucas quickly, we did say that in the initial stages of using testosterone supplementation, especially by the way of injection, you do get a decrease in your sperm production.
Yeah.
But a little bit later it increases. Can you use, therefore, if a man is struggling to produce a baby, can you use testosterone injections?
No, the injections will actually are contraindicated if they were trying to have a baby. If you're trying to have a baby, then you need to be, again, off-label. You take the other, because what's happening in our bodies, it's something which we call a negative feedback loop. Testosterone is produced in the testicles, it releases into the blood, it goes to a place in the brain called the hypothalamus, and then tells the brain, listen, produce a chemical called LH, luteinizing hormone, which goes through the blood and tells the testicles, let's produce more testosterone.
I see.
If you give testosterone, it tells the brain, decrease your LH, and so your natural production of testosterone and testicle and sperm will decrease. So what we're doing off-label with these medications is that they are similar to this LH, and so they cause the testicle producing more of its own testosterone, but it also bypassing the thing.
Lucas, your general from Georgia, are you still there?
Yes, sir.
Okay, what is your question quickly before we go to the end break, sir?
Actually, man, I was having a problem, doctor, for several years ago. I went to the doctor and then for a checkup because I was not active anymore on sexual side, and my testicles was painful. Then when I came there, he checked me and then he told me that I've got a sugar diabetes. And then from there, when I take the treatment, the pills, they never handle my body actually nicely, because I was starting to vomit and not going well, and I never go back again to the doctor.
Which pills were these, quickly?
Sorry?
Which tablets were these?
I don't know what is their name, but it's the big tablet, the round one. And because I was getting them from the chemist also, and the other one, they were small one.
Yeah. Okay.
Then, but it was not concerning the problem that I was having, because I told him my testicles are painful and I'm not active anymore, and it's a problem when I'm supposed to meet in the house, and then I'm just weaker, and then I'm not interested anymore.
So I don't know what is the problem, because I
How
never go to...
how old are you, Lucas?
I'm 37.
37.
Yeah.
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 Oh, this is exactly the point, Lucas. Again, you need to get it checked. Unfortunately, you must remember that doctors, we're also humans, and often we feel uncomfortable about talking about the sexual aspect. But what he actually went with was a sexual problem, which he needed to be investigated, and they did find sugar diabetes. And unfortunately, the treatments for diabetes, hypertension, cholesterol can decrease your sexual function even more. But the point is that it still needs to be addressed. And if
Let's hold it there. Let's go to the ad break. When we come back, we're going to give him more concrete solutions,
No
which will not benefit him, but everybody else who's listening and concerned. We'll continue our discussion on male menopause after the break. Welcome back. One is South Africa. Bonitas House Call or SABC2. And today we're discussing male menopause. We're just making the point in reference to and in response to Lucas's question, calling us from George.
That's right.
So he went to the doctor. He felt that both his libido and sexual performance had declined quite significantly.
That's right.
Worried him as a man, because that challenges his manhood, that challenges the ego, and of course he wanted to deal with that issue. Then he's told he's got diabetes. He's given tablets. He decided he's not going to use those tablets anymore because
they were actually causing more problems for his sexuality. That's the problem.
Yeah.
You see, the thing is that if you've got a first episode of erectile dysfunction or sexual problems, we know that 80% of those people have some underlying cardiovascular risk, high blood pressure, sugar diabetes,
80%?
cholesterol. 80%.
Only 20% would have issues where stress is involved.
Well, everyone will be stressed by
Okay.
it, but just from causes from stress and sexual mental problems, it's only about 20%. So most of them are going to have a problem. In fact, we know that there's a lead time, what we call, where if you get erectile dysfunction, and it's been consistent, you've got a 5-year period where you're going to be having some cardiovascular event in the next 5 years. So stroke,
renal
loss of
failure,
limb,
whatever, heart attack.
So it's not a Mickey Mouse disease. When the guy comes in, the physician did the right thing. He actually said, let's go and check everything. He found that there was sugar diabetes, and he started him on treatment for it. And unfortunately, the treatments themselves can sometimes decrease your sexual function as well. So the problem from this physician is that he actually didn't address the underlying problem. And there are treatments for erectile dysfunction, for decreased libido. These are the testosterones and what we call the PDE5s particularly. These are the Viagras, the Cialis, the Levitras.
Do they work, those things?
They work very well. The data is excellent for them. And in fact, it's off-label again. Maybe we're going to have data in the next few years that it actually has a cardioprotective effect. It seems to recoat the inside of coating of the blood vessels, which we call the endothelium. And we now know that all of these drugs cause what we call endothelial regeneration. They improve the blood vessels. So the whole point is that if you do have erectile dysfunction, you've got decreased libido, you must get yourself checked, change your lifestyle, exercise, diet, no smoking. But after that, if you're having these problems, you need to get your testosterone supplementation, and you need to be put onto medications to help to improve your erections. And they work so well. Their side effect profile is excellent. The only things you mustn't be using them with is if you've got on something called a nitrate, which are those tablets that we use for angina, where you're about to have a heart attack, they put on the tongue. Almost no cardiologist uses them anymore because they don't actually affect the long-term benefits for the heart. Or if you've got recent myocardial infarct or congestive cardiac failure. Basically, the only reason why you're not allowed to use them then is because sex is a form of exercise. In fact, if you have sex 50 minutes per day, you can burn off the equivalent of a Big Mac McMeal every 2 weeks just by sex. The worst slow poison you can get in the location is the wife not giving you some sex. But the point is that if you don't have
I want you to repeat that statement.
The worst slow poison, which is the thing where the wife's just apparently killing us. The worst one is when the wife is not giving you sex.
Because sex has got lots of
sex has got so many benefits, not only the exercise part, but the orgasm and ejaculation also has benefits as well, including releasing chemicals in your blood like oxytocin, which improves the mood.
Speaking of which, you mentioned that psychological manifestations of low cholesterol levels,
low testosterone
levels in the blood. Aggression, depression, they seem to be on
different sides of the thing. But the point is that they're actually related. There are it's a very complex situation, but the point is this, as Dr. Golding was saying, it's very subtle. Some people will get depression, some people will get aggression, some people will get sleep problems, some people will get loss of memory. And sometimes they can get all of these things at the same time.
Because there's so many men who walk around with these things.
That's right, and that's what's happening in a lot of guys. The point is it's all about this testosterone. And the point is there are other chemicals that are important. You have to get yourself checked generally. But I can tell you that the majority of people who have these issues, it's because of low testosterone.
But Professor Shinga, I don't want anybody to walk in here and say we are having a sophisticated talk here. Do you mean any man in the street, any man in Koba, any man in Haskukuni, any man in Mthalome can walk into a clinic and say to the sisters, I have 1, 2, 3, 4, 5, can you check me and can you check my testosterone level?
That's right.
Are you not going to be seen to be metrosexual or CC, as it were, when you complain about such things?
No,
are you certain?
This is exactly the point. We as men don't take our health seriously. We are actually killing ourselves because we're thinking that we have to just keep it under the carpet, not talk about our problems. We have problems. We die younger than females. We're more likely to have performance problems. We have so many other issues which need to be addressed. You must feel empowered to go in, talk to the sisters, talk to your doctor, tell them that you've got these problems, and we as physicians need to address it as well, because we also have a problem of not discussing sexuality and general health as well. And if we don't check our patients for their testosterone, for their general health, sugar diabetes, not advising them to change their lifestyle as well, we're actually giving them a problem. And one of the big issues as well is that HIV, which is which is rampant in our country, and unfortunately the policies have actually decreasing the rates now. But HIV is what we call a vasculogenic and neurotropic virus. It actually damages your blood vessels and your nerves. Erectile dysfunction.
That's why a lot of people with HIV end up with strokes as well.
That's right. And in fact, erectile dysfunction is more common in HIV people as well. You need to get yourself checked out because HIV can be treatable nowadays. Please, prevention is better than cure. But the point is that don't be worried about getting it checked. You need to get it checked because you're actually going to protect yourself from dying as well.
Now, other than the fact that a lot of men don't present themselves for checkup and never even bother to check their testosterone levels because they don't know about its existence, which is why we have the show today. So apart from ignorance and the fact that men don't usually present themselves, even if they do have identifiable problems, for some reason men are reluctant to present themselves for assessment and treatment on these issues. And apart from the fact that access to the testosterone supplementation, particularly on libidos of this world, the medical aids equip them to pay for these things. Apart from those two, in your experience, what are the other problems that make it difficult for people to access, or to treat adequately male menopause, and therefore reduce the rate of all manner of complications that you get because of decreased testosterone, from cholesterol, from hypertension, and many other things that you and I have discussed today? What are the other?
It's the attitude of our patients and the attitude of the physicians. We both don't recognize it nicely. And the point, what I find is most important is to express to the partners that you must actually take your man in. That's where the problem is. I find that a lot of patients, if their partners are concerned, they're the ones who bring the patients in. We then make the diagnosis, we then get them onto treatment, and both the partners then get happy as well. Because remember that intimacy, loss of cuddling and touching with your partner is one of the other signs of testosterone deficiency as well. And in fact, even masturbation itself, which a lot of guys do, the rates of masturbation decrease, the rates of intimacy decrease, the rates of sexual activity decrease, and the partner is so important. So I'm expressing out to the partners out there, please make sure you take your man in if you find any of these symptoms as well.
What are those things that a partner might, if my guy decides to, or begins to have 1, 2, 3, 4,
okay,
I must worry. What?
Mood changes, not so happy, not interacting nicely, loss of sleep, aggression or depression. Sexual problems, not getting good erections, not having the feeling of wanting to have sex, loss of intimacy with the patient, with your partner, decreased energy levels in your partner, increasing body fat, less pretty looking husband or partner as well. These things are expressions of low testosterone and general poor health. And if you haven't been checked out, you please take your partners in, get them checked out.
Siyezwa ngempela ukuthi yize abesilisa bangahlangabezani nezinto efana nesifuthe nesifombo uma befika ku-change of life. Ziningi ke inselelo ababhekana nazo futhi ezingahle zibeke impilo zabo engozini nasenqephezweni. We'll round up our discussion on male menopause when we return. You're watching Bonitas House Call here on SABC2 and welcome back. Mkhaiso mogang o ile bora mare kono setsa thulaganya gompieno ka mafoka tshedimosetso go tswa go mitsana pe o re re tsere dikgang nae gompieno. Now, just before any ethnic differences between maybe Caucasians, Negroids, and there's racial differences in.
Most of the data has been done overseas, but we're now doing some locally as well. But it looks like it's across the board. It doesn't matter whether you're African or white or whatever. We all have the same problem. So if you have these symptoms, or even if you don't, still get yourself checked once a year. Get your prostate checked. If you're over the age of 40, get your testosterone checked, get your cholesterol, your blood sugar, and get yourself your general health, chest and everything else done as well. If you have symptoms, even more frequently than that if necessary. But the point is that it doesn't really matter what race you are. Just get yourself checked, guys, and change your lifestyle. Exercise, diet, no smoking.
Does diet play a role? I was just about to ask you that.
Oh yes, definitely. The amount, and it's not so much about the amount of fat in your diet. It's more about the number of calories that you're taking in. Remember, one of the big issues, if you've been reading the newspaper, is that there are even some class action suits against some of these fizzy drink companies because the calories that you're getting in there are so high, and that's what they can be converted into fat in your body as well. So try to cut back a little bit on the amount of calories. Don't be worried too much about what you're eating. Less is more again. Small plates. That's one of the I always tell my patients that doesn't matter what size plate you're eating, you're going to finish it and you're going to be satisfied. So get a smaller plate, eat a little bit less, decrease the amount of calories, increase your exercise levels, but get yourself checked by your physician.
Any one myth that exists out there about testosterone in the male menopause that you want to dispel today?
That testosterone is dangerous. Testosterone is not dangerous. It's necessary in your body. But the point is that when you look at these bodybuilders and people who are using it off-label to increase muscle mass, they're taking it in dosages which are hugely physiologically unwell. I mean, like the injectable I'm talking about is once every 3 months. Some of these guys are taking these injections 2 or 3 times a day. Less is more again. You need to use it in adequate dosages when you have a problem, not for everybody. So please, it's not dangerous if it's used in the prescribed method.
Your key message to me and everybody else who's watching today, what key message you want us to take?
Take your health seriously as men. You, as yourself, must get yourself checked out. Your partner must get yourself checked out as well. And it starts from day one. Everybody should be getting themselves checked. Make sure you get your health in tow. And the most important pill, I keep repeating, exercise and diet. Exercise, diet.
And would you say all of us men at some point will experience male menopause, whether we like
Almost certainly. The data basically says it's somewhere in the region of about between 14 and 40% at the age of 40, but probably it's higher than that because we don't know what the baseline levels were. So for some people, you might have had a very high testosterone as a youth, and for you it's relatively low when you reach that age. So I would say that basically everyone's going to get it eventually, and the treatment is so effective that really you're doing yourself a disservice if you don't get yourself treated.
Professor Singai Mutambira, thank you very much on that note. Thank you very much for having joined and enlightened all of us around this thing that many of us are already suffering from, maybe, or definitely suffer from in some point. It will put all our health in danger and our lives in danger as well. Bana mang khauliseng e Motswana morala masetla khaibane Basotho majapere a matle a masoro santse go le ka nna letsatsing la kajeno. We'll be back next Saturday with hair loss. Nina ba neng jipapa, don't miss it here on SABC2 at 9 in the morning. Ar kopana hape bekeng e tlang. Hlanganyela nate futhi ngo go tsaya. Re tla kopana he Thato Haile Morena. I'm Dr. Victor Ramoresi Ramathesela. Ya khaola yaya. Namane tshehla motang wa Mletsana. You take care.